what we could do is have question and answers. And please, anyone, throw some questions. Yes, sir.
Steve, you mentioned that you're taking some medications that
yes.
change. I assume that it's some sort of amphetamine.
Well, actually not, but go ahead.
I was just curious as to specifically what are you taking and what differences do you see when you have the medication versus when you do not have the medication?
Okay. All right. Okay. I think some of the behaviors of schizophrenia would be more apparent. I have to be objective about that. I have to step outside of myself and analyze, and I can do the reading to support that, what I've been going through. In 1970, when I was in the psychiatric hospital, I was on chlorpromazine, which is also known as thorazine. And that was a good intervention that helped calm me down. It helped then slow down some of the processes where you're bombarded by too many thoughts. That's great for an artist, but you got to focus. Some people don't even have those kind of experiences, and honestly, they don't. And a lot of people have a lot of it. Some autistics, they think in terms of words, not images. Like Temple Grandin and myself, you might have heard of Temple Grandin. Okay, she thinks in terms of images. That's the way I see things, in patterns. And so the intervention of medicine, okay, like there was MAO inhibitors, monooxidase inhibitors. They inhibit the uptake of the serotonin. They prevent serotonin from leaving your system. It keeps coming back so that you can calm down. That's really key importance. And so I was on Mellarol, Stelazine, over the years. In 1979, the year I was graduating, I was given lithium carbonate for the first time in my life. They seriously thought that I was manic depressive. Prior to that, I didn't have that diagnosis. For 21 years, I was on lithium carbonate. And that doesn't really do anything, but I kept telling them, look, it's not really helping. It helped maybe with mood swings because it does level you out. Lithium is a fascinating, I won't call it a drug, it's a mineral. It's like a vitamin. You take like a vitamin pill. There's lithium carbonate in the water. It's a famous story. It's in the water in Laredo, Texas. It seems like through the history of Laredo, Texas, compared to other local towns, they didn't have as much violence. From that well water, you just calm down. You don't have the ups and downs of manic and mood swings. So this is how it came into the marketplace, and it's effective use. However, I didn't need to be on it for 21 years, and I really wasn't manic depressive. When I did go off of it with much protest from my psychiatrist, nothing happened. I didn't go into catatonia, depression, or hypermania. And, nothing happened. And maybe that proves something, that nothing happened. In 2006, they started me up again on medication, and that really helped a lot. I was on, and I still am on Lexapro. They changed other different things that intervene in your chemistry for schizophrenia. Seroquel at bedtime. They've given me other ones at bedtime. And also, at my old age, they're not giving me amphetamine, they're giving me Wellbutrin, bupropion, Wellbutrin that you've probably heard of. It helps you focus. It does a similar job as it would with an ADD type of case, where they have a methylphenidate or Ritalin, that kind of thing. They help. Now, some people claim, no, we want to do nutrition. Well, that's okay too. I give people advice about nutrition. Any other questions about these interesting things? Okay. Jeremy.
Yeah, I actually have Asperger's myself, so I'm totally on the same wavelength with him. So, have you ever noticed with when you're working on your art, because I noticed you mentioned about the sleep, sometimes you can't sleep. When you're working on your art, it kind of puts you on a buzz, kind of a high, and you got to just keep going until you finish it.
Exactly.
So,
Exactly.
you know, I can see how you can't sleep, because once you get into the creative process, it just keeps you going, and you have to finish what you created.
Exactly true. Exactly true. So Jeremy's gone through that process. That's very,
you also
very
need a routine too. All autistic people got to find their little routine.
Yep.
And that's critical to healthy life. So.
That's exactly to succeed. Right here in this room. Yes?
Before I came here, I was at a yoga center, and we were discussing the need for sleep and how yogis don't need as much sleep, and they're always in a meditation zone, so they're in the present, they're not dwelling on the past, or very similar to what an artist does when they're in the zone, and they don't need as much sleep. And the guru got held up in an airport for 20 hours, and they said, well, what did she do? Well, the need for ritual, it's the mantras that they chant, it's their way of coping and staying in the present, and then you don't need as much sleep.
They say they're given nutrition from the prana,
right.
from the breath of life.
The breathing and the mantras.
Yeah. There's someone in the far back. Yes?
I like the works that I've seen, and I was wondering what medium you work with.
What media?
Medium.
Okay. Some of those paintings back there are oil on canvas, and there are dates on them. They're from the 80s. And I also have canvases back there that are acrylic on canvas, and then there's a painting back there that's acrylic on wood. I actually like painting on wood better than the bouncy effect of the stretched canvas. That painting back there on wood is a painting of Darold A. It's from a photograph of him recently taken in 2005. Darold A was 15 years old in 1943 in Mississippi, where Leo Kanner was the psychoanalyst, scientist, and he was studying autism. And Darold A had autism. He would walk around the golf course like this. He had a characteristic gait, and he was an excellent golfer. And he had been with Kanner a long time. One of the names of the high-achieving autism spectrum type is Kanner syndrome. And Asperger syndrome and Kanner syndrome are basically the same thing. Anyone else? Lots of questions. Yes, ma'am.
Do you actually own schizophrenia? Do you feel that you definitely were diagnosed correctly as far as schizophrenia and Asperger's?
Thank you for asking that, because I did forget to say. You have to have this as a birth defect. You're born this way. You live through life so that you can somehow come out and then communicate, but you're working all the time, and you're actually understanding the language around you. Usually, cases where they're withdrawn, they actually, when they come out of it, they're actually talking in full sentences right away, like there's a breakthrough, because they've always been hearing you and understanding all along. That's very, very typical. Schizophrenia and any form of mental illness could be caused from any form of trauma. It could be a biological head injury. It could be something that happened in your upbringing or something that upset you, or it could be from abusing drugs or alcoholism. Suddenly they're seeing pink elephants. But the problem with schizophrenics, and also in a psychiatric institute, is, I'll make a point, the ones that have autism that are institutionalized really don't start fights or trouble. Schizophrenics, they have an issue because they remember back when they did not have the hallucinations and the confusion. They remember that at one point in my life I was normal. That's the way a schizophrenic would see himself.